Okay, play therapy is the medium that we utilize when we're working with children. Children don't have the cognitive ability or the verbal ability to really talk about what's going on with them. So we meet them at their developmental level, which means they're going to play out what's going on with them. So we use play to process all of the different issues that they're working through or that they're stuck with. So there's specific theoretical orientations that we use. There's every single toy that we use has a purpose, and it's very intentional. And it's well researched that it helps children because we're meeting children at their level rather than an adult level. So that's what play therapy is. In terms of our certificate, we have a play therapy certificate, which basically was created for individuals that would like to become later on certified play therapists. In our field, we have different specialties, and one of them is play therapy as a specialty. And there is an organization, the Association for Play Therapy, which certifies people who say, I've had the training, I have the knowledge, I want to be recognized as somebody who knows what play therapy is, and this is what I do in my practice. So they require that you have specific educational classes, and they also require that you have specific clinical hours. The certificate was created to provide those educational classes that people would need, because the hours people will gather either through their master's program as well as through the time that they're getting their license. You cannot be certified until you have a license or school certification. So these 4 classes are the 4 areas that the Association of Play Therapy requires for somebody who wants to be certified. Now, people in this program have taken either the 4 classes because they wanted to seek certification, or some folks wanted to have a little bit of knowledge about how to work with children, so they would take 1 or 2 classes and get exposed to how do you do therapy differently when you're working with children, and how do you use play therapy. So those are the 4 classes that we offer. We offer 1 in the fall, 1 in the spring, and then 2 in the summer. So within a year, you can get all of those courses, and then later on you can continue accumulating your clinical hours. Because most programs don't really offer classes for children counseling. You may be exposed in 1 class or 2, but not for a specific course like the play therapy classes do. So overall, I would say most mental health programs across the country, they don't specialize in working with children. They specialize in working with adults. So the classes expose you to a different population, but also they also give you that specific training, because I've seen folks work with children who had no clue what they were doing. They were working with children like if they were working with adults because they didn't have the training. So yes, there is a need for child therapists, and also there is certainly a need to have more trained individuals.